Ulang dari awal. Assalamualaikum warahmatullahi wabarakatuh. We will present about postoperative assessment handover. Clinical anesthesia handover. Clinical handover is the transfer of professional responsibility and accountability for some or all aspects of care for a patient or group of patients to other person of professional group on a temporary or permanent basis. The important point of handover is safety. The right care for the right people at the right time. Nurses, midwife, and doctor. Result include length of stay, complaint, and claim.
Of guidelines and rules have been developed. This tool is called ISBAR, i.e. identification. Nurse introduces herself and her role. Identify the patient name, date of birth, and her number. S. Situation, diagnosis, the surgical procedure, or elective or emergent complication and intervention. Anesthetic, type of anesthesia, airway, bit blocks, positioning, lines, medication, IV fluid, blood products, and fluid out. B. Background, age, weight, allergies or pre-association, Basilian condition, and medical history. A. Assessment, hemodynamic stability and goals, intraoperative, even current management or paralysis, anesthetics record up to date, IV fluid infusion, and vital signs. R. Recommendation, task to do, post-operative management plan, pain management plan, post-op, and investigation. Next, Haris.
And then the last is contents used. And first, present perfect. The function of present perfect is refer to an action or step that either occurred at an identified indefinite time in the past or began in the past and continue to the present time. And present perfect active is subject plus have or has plus past participle. The passive of present perfect is subject plus have or has plus been and then plus past participle. For example, present perfect active is she has got a red ID bracelet and I have got it right here. An example for present perfect passive is they have been glued. And second, past tense. The function of past tense is used to talk about things that happen or excite before now. Past tense active, subject plus verb to, and past tense passive is subject plus was or were, and plus past participle. For example, past tense active is she had a boating accident last week. And for example, past tense passive is the drain was put on the wound. And past tense active is the second past tense active is subject plus was were. For example, is estimable blood plus was 765 million. And the last is modal. The function of modal is used to show abilities or requests. Modal active is ability, subject plus can or can plus verb one. For example, I can see it. And then for request is can plus subject plus verb one. For example, can you put the beer hugger? And modal passive is subject plus can or can plus be plus participle. For example, it can be removed soon.
Okay, thank you everyone. Assalamualaikum warahmatullahi wabarakatuh. Bentar ya, kuliah dulu ini. Ku end, terus kuliah.